My name is Ravi Anupindi. I'm a faculty at the Ross School of Business in Technology and Operations. I teach a class on innovations in global health delivery. And with me here is David Milestone. David Milestone is the acting director of USAID Center for Accelerating Impact and Innovation. As part of this role, his team does a fantastic job about helping governments, NGOs, private sector people to think through how to take a product idea in the space of global health and introduce that and launch it and scale it in the countries. And they've done a lot of research to develop guidance on this. So David is here to speak to my class, but also give a seminar. And thank you, David, for coming.
Great to be here.
Like to use this opportunity to share some of the thoughts that you have on this topic.
Great, glad to do it. Thanks for having me.
Thank you. So maybe just to kick this off, could you tell us a little bit about your organization? What is the activity you do and why?
Sure.
Why is this important?
Yeah, well, so I sit in a group called the Center for Accelerating Innovation and Impact, which is based in the Global Health Bureau of USAID. And we have really three lines of operations. The first is around innovation and catalyzing innovations, primarily through a grand challenge model. Our second team is focused on market access, because we know as important as it is to develop new innovations, it's even more important to make sure that we're getting those and other lifesavers to those who need them. So we bring in private sector principles and expertise, and a team made up of folks from the private sector to apply some of those principles to getting those to scale. The third piece of work that we do is really around capturing those best practices and sharing those with students like those at the business school here. And what I'm here to talk today about is a new publication we have called Ready, Set, Launch, which looks at this critical pivot from sort of global product development to one around selecting a target geography, and then more importantly, developing a practical, actionable, costed scale-up plan.
Right, wonderful. So speaking of the document, the latest document that you've created, the Ready, Set, Launch document and the project. So thank you for sharing. I've reviewed the document, and so maybe we can focus our discussion around that document. So a few of the questions that I had, one is, whose perspective are you taking when you're talking about launching the product in a country? Is it the government's perspective, private sector perspective, NGO perspective, donor perspective?
Well, as you know, there's so many stakeholders involved and needed to successfully launch and scale a global health solution, whether it be a product, a vaccine, a device, a diagnostic tool. And so we tried to take that into account when building this framework and generating this guidance for practitioners. But really the focus was meant to be agnostic, but with a target around donors, so folks like us at USAID, implementing partners who are really doing the work on the ground and making this stuff happen. Social entrepreneurs, many of which we work with through our Grand Challenge model, who are looking for guidance around country selection and scale-up strategies. But fourth, and most importantly, is the Ministry of Health, because they are ultimately the ones who are going to make this successful and sustainable. And so they're really the ultimate focus of this work. But recognizing all these different stakeholders have to understand their role in this ecosystem to make this successful.
But all of these different stakeholders may have slightly different objective that they want to achieve. Regardless of where they are coming from, ultimately what, even as a donor, you would hope for is a long-term sustainability of this initiative. What metrics, or what are some of the key metrics either you as a donor or a ministry should look for? Say at the end of whatever the launch phase might be, Ready, Set, Launch phase, say 3 years, 4 years. What are some of those key metrics that you would watch out for that at least ensures that when the donor funding is not there anymore, that this is going to scale and sustain?
Yeah, well, one of the key principles of this guide that we lay out is sustainability, recognizing that not all global health products can reach financial sustainability. Some just are public, need to be public goods, and so we need to differentiate between the two. When you're looking at products that don't necessarily have a pathway to financial sustainability, though that's where it's really important to partner with the Ministry of Health. And those metrics might look something more around health impact. And so making sure that we're reaching target users.
Right.
When there is a financial sustainability potential there, and you're working with private sector partners, whether they be manufacturers or delivery hospitals, for example, on the ground, those metrics might also be focused on health impact, of course, but ultimately you're going to get that financial sustainability probably through some metrics around finances, return on investment, all those pieces that business students know well. And so you really have to differentiate between the two, but make sure you're looking long-term at sustainability if it's in the public sector with the buy-in and ownership of the Ministry of Health, or in the private sector with a financial model that makes sense.
So is there a guidance document that, because I didn't see much, so as you said, if I take the ministry's perspective, maybe there is no financial model out there, but it is a meeting a health need. But at some point when the donor intervention is taken away, the ministry has to sustain it somehow.
Right.
Right. So what would one look for? That was the intent of the question, that this ministries will be able to sustain it. Where would they get the resources to do so? And if it's the private sector, then they're looking into, and I agree with you that not every intervention might be financially sustainable, but those that are, do you see this guide, because you work with the private sector too, that this guide is useful for even the private sector people who are looking at those interventions that offer them some financial value?
Yeah, well, I think that's important, and I should have mentioned this up front, that Ready, Set, Launch is the third publication in a series that we've introduced called our Idea to Impact series, looking at sort of what it takes to get a product from early ideation all the way through scale up. Our first publication was called Idea to Impact, and that looked at sort of this global perspective of all the different components related to delivery that need to be addressed well in advance of product approval. We know that in global health it sometimes takes decades for global health products to reach even a small percentage of their intended users. So what we wanted to do is lay out some structure to help improve on that, because we know that planning early, well in advance of approval, can increase likelihood of success. Our second publication was really focused on the private sector partners, specifically social entrepreneurs who are doing and generating a lot of the new ideas and thinking in global health. And what they often lacked was this perspective around what are some of these pathways to scale and financial sustainability. And so our second publication was called Pathways to Scale, and that looked at different business models, whether they be licensing, partnering with a med tech or pharma, for example, licensing out IP, a whole host of different pathways that may change along the sort of life across the lifetime of a certain innovator or entrepreneur. But looking at those financial models and business models, but also partnership opportunities. And so that really takes a deep dive into kind of that financial sustainability, and would encourage folks to check out our website at usaid.gov/CII, where you can download all three in the Idea to Impact series.
Okay, that's wonderful. Great, thank you. And this raises the issue, as you said, any of these initiatives, it's not, there are multiple stakeholders as we started discussing. So when you have multiple stakeholders engaged in these activities, you still need to have what I've been calling an orchestrator for the whole initiative. So who would be the ideal orchestrator? Would it be the ministry? Would it be the private sector? And what are some of the challenges in that orchestration? I'm sure you've looked at that. Just what are your thoughts on that?
Well, we have actually in our Idea to Impact publication, the first in this series, we dedicated a whole chapter to this idea of an uptake coordinator. And this was an idea that has long been seen in global health, but is done every day in the private sector, whether it be in a med tech or pharma company. And these are people responsible for progress against goals. In our case, this uptake coordinator, what we do in Idea to Impact is lay out sort of the right skill set that these folks would need in place. the accountability, the buy-in, and who are sometimes the right organizations to host these folks. And so, in the case of a public sector, the ideal location of this idea of an uptake coordinator is within the Ministry of Health. That's not always possible given budget constraints and things like that. And so, for example, we completed some work in partnership with the Ministry of Health, the Clinton Health Access Initiative, Dahlberg Global Development Advisors, and USAID Nigeria, along with their big partner, the Maternal and Child Survival Program, around developing a scale-up strategy and implementation plan around chlorhexidine, which is a low-cost antiseptic that can treat umbilical cord infection and reduce neonatal mortality by sometimes over 20%. But what we did in that work with the ministry is, using the Ready, Set, Launch framework, laid out the implementation plan and assigned responsibility to key partners in country to achieve these certain targets, but ultimately gave responsibility to the coordination of those efforts to an uptake coordinator who sits in partnership with the Ministry of Health, but who sits within USAID's implementing partner, the Maternal and Child Survival Program in Nigeria. And so sometimes you have to be creative about where you place these people and the kind of accountability and the decision-making power that they have. But ultimately, what we've seen is that success is only able to occur when you do have somebody who's held accountable and who can help sort of bring all these different pieces together.
So that raises a question, because this is a challenging task, and I worry about the capability gap among the people, whoever you want to identify, people in an organization, are they able to take up this challenge and actually fulfill that role? So do you see that as a capability gap? And if so, what is USAID doing or other people doing? Maybe there are other actors who can come in and fill that gap and provide training and upgrade the capability of.
Yeah, I mean, I think it comes down to hiring, right?
Yeah.
You have to get the right job description and the right folks in place. Ultimately, we know that you need people who are from that location, geography, understand that ecosystem. Mm-hmm. That's the first criteria. But ultimately, it's probably someone than a traditional global health practitioner. So probably someone maybe with an MBA and who has experience with project management and management generally. And so those are the type of skill sets that we as a center are trying to bring into to global health, but also are encouraging our partners, implementing partners, to bring in that kind of skill set to oversee some of this work.
From the implementing partner side of things to bring in the skill set.
And I would also just mention we have a partnership that we're a part of called the Aspen Management Partnership for Health. This is actually focused on ministries of health and building this type of leadership and management capacity with private sector expertise. And so we second and place what we call a management partner with that private sector experience to work as part of the Ministry of Health team to both design but then implement community health programming. And so this is an area across the board, whether it be product scale-up or community health or vaccine delivery, this recognition of this type of expertise that's generated in business schools and in the private sector, and the ability of that expertise to complement the strong public health expertise that resides in ministries is a really strong combination.
It's very interesting. So one of the other things is that clearly these are to be able to undertake this task, what you have articulated in the Ready, Set, Launch, there's a lot of information that needs to be made available to somebody who's going to think this through, whether it is basic demographic information, economics of a particular country, etc. But more than that, just business practices, how to do this stuff. I assume that you're building this data repository within USAID where people can go to one place saying, oh, okay, can I see example of this? Can I see example of that?
Well, and we were very careful to not oversimplify this process. We know that this is very complicated and is a lot of work. And so the first thing to recognize is this isn't something that's done overnight. And so, going through that Ready, Set, Launch framework takes some time. We also recognize that there's a Cadillac version of what can be done and how you approach some of these activities that are outlined in Ready, Set, Launch. and then we'll call it a bicycle version that might be not as sophisticated or as detailed, but at least addresses all of the main points that we're laying out. And so I think depending on whether you're a donor and recognize the type of potential health impact that you can have, and you dedicate more resources to finding some of this information, or a social entrepreneur who needs the bicycle approach but can still then understand what they're up against and identify the big bottlenecks and plan appropriately, is a right way to frame it. We're also, as a center, and what's available online on our website, which I mentioned earlier, is a toolkit where we're beginning to compile some of these examples. I mentioned the Nigeria chlorhexidine national strategy that the Ministry of Health published a few months ago. That's available on our website. And to develop that, we actually followed the framework in Ready, Set, Launch, so folks can sort of see that Cadillac version. And what we've also done is in that toolkit, which I think is a really valuable resource for folks, not only provided the templates to address some of these activities that are laid out, but also provide examples of some filled out already. So it can begin to provide some inspiration and examples for folks looking to do this. But don't fret, we know it's a complicated process, but this is meant to get people moving in that direction and thinking about approaching scale up in a more structured way.
Wonderful. I mean, thank you for this broad summary of, and obviously look forward to the more detailed talk. Maybe just to switch gears as we close out this, obviously you're very, very passionate about the space and what you do, but you came, if I look at your background, I mean, you were in the private sector, both in a med device company, consulting, also have an MBA, and then moved into the space. So talk a little bit about that journey, why, how did that happen?
Well, I've always been passionate about healthcare, thought about becoming a doctor in college, but ultimately loved widgets and gadgets, and so followed my path towards engineering, but really stayed focused on healthcare and pursued the MBA. Actually worked for a medical device company that was based in Kalamazoo, Michigan, called Stryker, even though I was based in the New York area and spent a lot of time in India. But it was during those trips to India that I got really excited about the potential health impact in the emerging markets in the developing world, and the value of this strong complementary business skill set that can really be a strong complement to the work that's going on in global health. And so this connection of my passion for healthcare, this really important work that we're doing in the developing world, and the great creativity and innovation that happens at that nexus is really exciting. And so encouraged that a lot of business students are interested in this, because we certainly need that thinking in global health.
So, because you mentioned the business school students and that's been your pathway, what advice would you have to the current business school, either MBA students or even people from School of Public Health? Because this is kind of bridging the boundaries between health and business.
Yeah. Well, I would look for that balance, because I think there's value certainly in cutting your teeth in the private sector and understanding that skill set so that you'll be better equipped to bring those skills into the global health arena. But at the same time, it's so important to understand the local context, and I don't think you can necessarily do that by one or two trips to whether it be Africa or India or Southeast Asia. Really look for opportunities to spend and live in these geographies, because that's really where you're going to understand the unique challenges, but also the exciting opportunities of this space.
Great. Thank you so much. It's been really a pleasure to talk to you, and thank you for taking time from your busy schedule to come visit us.
Glad to do it. Thanks.
Okay. Thank you.